Let me start by saying that if you look at the indices of Nigeria, look at maternal mortality rates, it's in the 800 per 100,000 live birth. We, by 2050, will be the fourth largest country in terms of population globally. We have to be worried. And the things that have exacerbated our problems are in the character of our nation. Why I say character of our nation is that some of these things, other countries have been able to manage them, but we've not been able to manage them because a lot of the things that actually affect health lie outside health. Economic issues, political issues. If you don't have good political will within a health system, no amount of input you put in the health system will work. So it's in the character of the nation, and we need to, as a country, begin to shape our character so it can dovetail in every sector of our country. The same things that have dogged us even politically are the same things that are dogging us in the system, So when people talk about health system almost like an isolated space, I worry because it means we're not connecting the dots. The critical issues are around governance issues, and I'll give you clearly. When you look at funding for health, the health sector over the years has suffered in terms of funding, and then within even that funding stream, the burden of diseases is a pyramid, and it's a pyramid like this, right? Your standard pyramid. At the bottom of the social pyramid, you have most of the diseases that afflicts the poor in areas of squalor, where there are no water, we are talking about even cholera epidemic, and all that. So a large chunk of our disease burden, let's say 70-75% are at the bottom of the social pyramid, right? Because a lot of other people who are upper class in sense of access to the things of life, income and all that, can afford to have the services that gives them some level of protection, right? But when you come to invest in the health system, what you see in Nigeria is an inverted pyramid. We tend to put a lot of money in tertiary, secondary level because of procurement issues. I say it's in the character of the nation. Procurement. People want where they make money and all sorts of things. Politicians, everybody, they want to make money. So you put money there and they forget that the primary healthcare system is where the bedrock of the health system is. And Obasanjo should be able to walk out of Water Farm 10 minutes and get treatment for uncomplicated malaria in a primary healthcare setting of Water. But we have not gotten there. Why? Character of the nation. Because people are so fixated on making money, enriching themselves at the detriment of the society. And they forget that if an accident happens in Kaduna Abuja road, with all this crazy road there, like we saw with the Minister of State for Labour who had an accident there, because the window of response time to get into good healthcare was not there. The man died. So it can happen to anybody. Nigeria can happen to you irrespective of your wealth. So we need to come back to the table and say, look, how do we make sure that health is in our policy, that we see health as the cornerstone of everything we do in the country? Because one thing COVID clearly showed all of us is that even with the high-income countries,
the way we speak, I'm sorry to interject,
yes.
The way we speak, it's as if it is doomsday for, healthcare delivery in Nigeria. And I'm just like a former vice president of this country, had cause to seek medical care right here in Nigeria, medical treatment right here in Nigeria, which is an indication that yes, we could have our issues, but we do have facilities, we do have personnel. So why is it that, these push factors or these young minds are going out? Is it lack of patience, which again is in our character?
Okay. So I was coming to the positive side. The positive side is that in every setting, you have entropy, what you call entropy in science, where there are factors that play out that you can't even sometimes fathom how they play out. One of the things that's coming clearly is technology. Health technology recently has actually improved some of the opportunities to be able to drive an agenda for health, especially in private sector, because they are tapping into that. The problem with health tech in public sector is that people abuse it, abuse the procurement processes and bring substandard things. So it's a way of those things. They tilt in different ways. So for the private sector, they are unlocking the opportunities. So like my brother from Canada mentioned, there are facilities in Lagos that are doing very well. So, but they
private facilities.
Yeah, private facilities, but they are outliers in a system. And it is only for us to be able to learn from that. I'll give you one other problem, for example. We've had PPPs in public partnerships in health system in Nigeria.
Yes, of course.
Nobody has documented.
Gariki Hospital is a
beautiful. Nobody has documented the outcome of those PPPs. We should be learning as a country. One, we don't have information. What has happened? How did they work? What were the good sides? What were the downsides? What have we, as a country, we need to be learning from all those things. We don't. So that's why I say some of those things are in the character of the nation. But there are positive sides, especially with the young people. One of the things my organization does is actually we work with the Africa CDC, what they call the Africa Health Tech Summit, which holds in Kigali. One of the things we've been doing across Africa is actually to unlock the opportunities for young people who are tech savvy to be able to see how they can bring a common agenda to health. How can they bring low-tech devices that can improve outcomes for people? These people, a lot of young people have so much talent in Africa in the tech space. So those are some of the things that are, like I said, the positive sides. But before you get the bandwagon to create that critical mass, it's a conversation that the public sector needs to also sit up and be critically part of it. But the good side again for Nigeria in terms of governance, let me tell you, up front here, Nigeria has never had, let me say, the right set of people, especially at the national level, to head its health system like you have now. Professor Pate is a friend. I know him very well. Muyi, I know him. I know Kelechi. So these people are astute people in terms of their space. They know it. They know what the issues are. But the structural issues and political dimensions of governance is what will determine how they're able to move.